Blocked heart arteries are a hidden danger in your legs and feet. Hey everyone, it's Norma. We all know that heart health is crucial, but did you know that blocked heart arteries can impact your legs and feet? It's true. Today, we're diving deep into the warning signs of Peripheral Artery Disease, or PID, a condition that can lead to serious complications if left untreated. PAD is a condition where plaque builds up in the arteries, restricting blood flow, and it can happen in the arteries of your legs just like it can happen in your heart. Stay tuned to learn how to recognize these symptoms before it's too late. Let's talk about the first sign of PAD, leg pain, or cramping. Doctors call it intermittent claudication, which sounds a lot more complicated than it is. Imagine this, you're walking down the street, or maybe you're climbing a flight of stairs, and suddenly you feel this cramping pain in your calf, thigh, or even your buttocks. This pain is your body's way of saying, hey, my leg muscles aren't getting enough blood flow here. The thing is, this pain usually goes away when you rest. Think about it. You stop moving, your muscles relax, they don't need as much blood flow, and the pain subsides. But here's the catch. Just because the pain goes away doesn't mean the problem is solved. This is your body trying to tell you something important. We've talked about leg pain, but PAD can also show up as numbness or weakness in your legs and feet. Our nerves need a constant supply of oxygen and nutrients from our blood, just like our muscles do. When that blood flow is reduced, the nerves don't get what they need to function properly. The result? You might start to feel tingling, pins and needles, or even a burning sensation in your legs and feet. In more severe cases, this reduced blood flow can lead to actual weakness. You might find it hard to walk or stand for long periods. Simple tasks become harder, and you might even experience some stumbling or difficulty maintaining your balance. This numbness and weakness can be super frustrating because it really limits your mobility and independence. Here's a simple test you can do right now. Feel your feet. Do they both feel the same temperature? If one foot or even just one leg consistently feels colder than the other, it could be a sign of PAD. Remember how PAD restricts blood flow? Well, our blood carries heat throughout our body. When that blood flow is reduced to our extremities, our hands and feet, they're the first to feel the chill. It's like turning down the thermostat in just one room of your house. The rest of the house might be warm and cozy, but that one room is noticeably colder. This coldness isn't just a minor inconvenience. It's a clear indication that your body isn't circulating blood as efficiently as it should be. So pay attention to temperature differences between your legs and feet. Next, let's talk about wounds and sores and why they're a big deal when it comes to PAD. Our bodies have this incredible ability to heal themselves. But here's the thing, when you have PAD, that healing process gets disrupted. The reduced blood flow means that those essential nutrients and oxygen aren't reaching the injured tissues as quickly or as effectively as they should. So what happens? Those small cuts and scrapes, they don't heal as fast. They might stay red and inflamed. They might ooze fluid, and they might even develop into open sores, especially on your feet and toes. So if you're noticing that wounds on your legs or feet are taking an unusually long time to heal, don't hesitate to seek medical attention. Our skin is like a window into our health. It can tell us a lot about what's going on inside our bodies, and changes in skin color, especially in our legs and feet, can be a warning sign of PAD. If you're noticing that your legs or feet are looking paler than usual, almost like they've lost their natural color, it could be a sign that they're not getting enough oxygen-rich blood. Another color change to look out for is a bluish tint, especially when your legs are elevated. This bluish discoloration, known as cyanosis, happens when the blood in our veins isn't carrying enough oxygen. Pad can also cause your skin to look blotchy or mottled, kind of like a marble pattern. This is because the blood flow is inconsistent, with some areas receiving more blood than others. If you notice any unusual changes in color, especially in your legs and feet, it's worth bringing up with your doctor. You know how doctors always check your pulse? It's not just a routine medical thing. It's actually a vital sign that tells us a lot about how well your circulatory system is working. And you know what? You can check your own pulses too, especially in your feet, to get a sense of your PAD risk. Here's how you do it. Find the pulse on the top of your foot. Gently press your fingers on this area and see if you can feel a pulse. Now do the same thing on the other foot. If you're having trouble finding your foot pulses, or if one side feels significantly weaker, it could indicate that blood flow to your feet is compromised. This next sign might surprise you. Hair loss. Our hair follicles, those tiny little organs that produce hair, need a steady supply of blood to grow. But when you have PAD, that blood flow to the hair follicles gets reduced. Without those essential supplies, the hair follicles can't function properly. As a result, you might start to notice that the hair on your legs is thinning out, or it's growing more slowly than usual. You might even see patches of skin where the hair has completely stopped growing. So if you're noticing changes in your hair growth, don't just dismiss it as a normal part of aging. Let's talk about a sensitive topic, but an important one, especially for men erectile dysfunction, or ED. ED is more common than you might think, and while it's often associated with stress, anxiety, or other factors, it can also be a sign of underlying health conditions like PAD. The arteries that supply blood to the penis are just as vulnerable to plaque buildup as the arteries in our heart, legs, and feet. So when those arteries become narrowed or blocked, it can restrict blood flow to the penis, making it difficult to get or maintain an erection. If you're experiencing ED, it's essential to talk to your doctor. They can help you figure out what's causing it and recommend the best course of treatment. In the most severe cases, PAD can lead to a very serious complication called gangrene. Gangrene happens when blood flow to a part of the body becomes so restricted that the tissue actually starts to die. The early signs of gangrene can be subtle. You might notice that the affected area, usually a toe, foot, or finger, becomes cold, numb, and painful. The skin might change color, turning pale, blue, or even black. One of the most concerning signs of gangrene is a foul-smelling discharge or pus coming from the affected area. If you notice any of these symptoms, especially if you have other risk factors for PAD, it's essential to seek immediate medical attention. Early detection is key. That's it for our deep dive into the warning signs of blocked heart arteries in the legs and feet. Remember, PAD is a serious condition, but it's often preventable and treatable, especially when caught early. If you recognize any of these signs in yourself or a loved one, please consult a healthcare professional. Don't forget to like, subscribe, and share this video to spread awareness about blocked heart arteries in the legs and feet.